All right, everyone, I think we will get started. Welcome along, everybody. I hope wherever you are around the country, you're lovely and warm and tucked up somewhere nice. My name is Rachel Udamapu, and I'd like to welcome you to this Cancer Support Look Good Feel Better Q&A session. Now, it's wonderful to see everybody joining from around the country. I know we've got quite a wide selection of people joining. Now, I'm going to do some introductions very soon and introduce our session. But before we get started, my name, as I say, is Rachel Udamapu, and I come to you today from New Plymouth. So she's a little bit grey and being a little bit dark out there today. I've been with Look Good Feel Better since 2009, and I run the community classes in Taranaki, both in New Plymouth and in Hawera. And I've been running those classes since, as I say, since 2009. Now, we've just got a little bit of housekeeping before we carry on. So what I'm going to do is we'll have you all on mute, just so that we can have our wonderful guest speaker talking and we haven't got any noise in the background. But what we'd like to do is we very much want to hear from you once Belinda's finished talking. So what we'll do is we'll go to we'll let Belinda talk, and then we'll do our Q&A chat session after that. So, and there's a couple of ways that you can ask some questions. A whole lot of people have sent questions in already, which is fabulous. Thank you very much. But you can also, there's a little chat function at the bottom of your screen, and you can click on that and you can pop your question in the chat. So we'll look at those at the end. Plus, you can also, if not, you can just raise your hand and we'll be able to get to your questions through there. I do just want to say that, so in these sessions, our guest speakers don't provide any medical advice or answer any questions that are specific to individual medical situations. We do encourage you all to speak with your doctor or oncology team if you've got any personal health and treatment plans. But it's not me that you want to hear from today. So I would love to introduce our wonderful speaker, Belinda Reeves. And Belinda's going to talk on nourishing your body through cancer. Belinda's a dietitian, and she's going to explore practical nutrition support during cancer care and offer some simple evidence-based guidance to help maintain strength and energy. Led by experienced Belinda's an experienced oncology dietitian, and so this session is going to focus on realistic strategies without any pressure. You'll leave, I think, feeling reassured, informed, and more confident in making food choices that will support your body. So, Belinda, welcome.
Thank you
for coming along.
Thank you. Now I'll just get my presentation up and share it. All right. Thank you, Rachel and Christine, for asking me to come and speak today. As Rachel said, I'm a dietitian who I know I've worked in oncology for quite a long time now, in various areas, radiotherapy on the acute wards in various hospitals in the community. And at the moment, I'm currently working at Alevia, which is an elective surgical hospital in Auckland, where I am seeing mostly patients with head and neck cancer, but I also see people with colorectal and upper GI surgical patients as well. So what I'd like to do today is just to cover and go through why nutrition is really important during cancer treatment and also beyond cancer treatment. I'll talk a little bit about survivorship and what that involves in terms of the nutrition aspect. And I'll also go over some common myths that are often raised from patients that I see. I just want to put a bit of a disclaimer out there that this is a really general presentation because I understand, people are at all sorts of stages with their cancer diagnosis and their cancer treatment, and people have got lots of different types of cancer that they've got and going through different types of treatment. So what I would like to say, and probably reiterate what Rachel said, is that if you are having trouble with maintaining weight, you're losing weight, you've got no appetite, please reach out to your treatment team and get a referral to a dietitian so you can get personalised nutritional advice. So as you all know, cancer treatment can be really stressful on your body. what good nutrition can help you with is maintaining strength, so maintaining muscle mass, maintaining your energy levels so that you've got the energy to get to appointments, to do the things you want to, do your daily activities. Good nutrition also supports healing, particularly people who've had surgery or are going through radiotherapy. Your body has got a lot of demand for healing, and nutrition plays a huge role in that. Nutrition also supports your immunity, so it can help with decreasing your risk of infection. And good nutrition will help you with managing some of your side effects that you may experience during treatment. So good nutrition overall will help you get through your treatment, and it will mean less delays, and it will help with your recovery at the end of treatment as well. So when I see patients one-on-one, I go through a number of nutritional goals with them, and they're pretty much these 4 things. So what we really like patients to do is to maintain weight throughout their treatment. We want to really prevent loss of muscle mass throughout treatment. We want them to stay hydrated, and we want to manage any side effects that they may be experiencing throughout their treatment. What I'll do is I will go through each of the different macronutrients and things, but that's been, there's a lot of research around that if you lose significant weight throughout your treatment, then you do not tolerate treatment as well. So that's why we're always sort of looking at your weight. But what's really important is it's the muscle mass. We want to maintain as much muscle mass as we can, because muscle mass is directly linked to your energy levels as well. And losing muscle means you lose strength, which can put you at risk of things like falls, which then, has a knock-on effect as well. Hydration is really important. Obviously, things like chemo, your kidneys need to be well flushed out. Hydration can impact on fatigue levels as well. And then, as you know, there are many side effects that can occur during treatment. So I will touch on those a little bit as well. So eating well when you have been diagnosed with cancer, the general healthy eating guidelines still apply. Eating plenty of fruits and vegetables, and including whole grains and milk products, and including lean meat and plant-based proteins. However, that's all well and good. But when you are going through treatment, you get a lot of side effects that can really impact on your ability to follow these guidelines. So these guidelines may not apply during your treatment phase. These are just some of the side effects that I come across that people are experiencing. So things like fatigue, just having a shower in the morning can be exhausting, let alone trying to prepare 3 meals a day with snacks in between. Nausea, vomiting can be from chemo, it can be post-surgical. Taste changes, again, radiotherapy, chemotherapy. Appetite changes, sore mouth or dry mouth, and again, that can be from your various types of treatment, whether it's chemotherapy or it's radiotherapy to the head and neck area. Bowel changes, and that can be diarrhea or constipation. If you're really constipated, you don't feel like eating. Weight changes, and again, that's not just weight loss, it can be weight gain from various treatments, and I'll talk a little bit more about that. Chewing and swallowing changes, and a lower immunity, so increased risk of infection. So what I want to say is that even though there are those healthy food guidelines when you have cancer, it's really important that you're flexible and you're kind to yourself when you are trying to get through treatment. Eating can be difficult, and it's a double-edged sword, because your body needs more protein and more calories as you go through treatment so it can heal and recover. But then you've got all these side effects that actually make eating really difficult. So it's a really tough situation. There are some really, really good resources around that go through each of the side effects, and I can email those through. some of those side effects would be a whole nother presentation on its own. So what I want to do is just sort of talk about the common things that are really important to focus on with your eating during treatment. So when we look at food, we often split it up into different macronutrients, and protein is one of the ones that I really like to focus on. Protein is really important for maintaining your muscle mass throughout treatment, and it's really important for your healing. Now, your requirements are significantly higher as you go through treatment. So someone, for instance, who weighs 70 kilograms, if they weren't going through treatment, roughly their requirements would be about 70 grams of protein per day. However, when you're going through treatment, it's at least about 85 grams of protein per day. Your body is continually using protein for the healing. So if you're having radiotherapy, that's destroying cells, and your body is trying to repair those cells. So it's always needing that good protein. Now, protein is obviously in your meat, chicken, fish, eggs as well, dairy products, so your milk and yogurt. And we're really lucky these days that there are some really high protein dairy products out there. So making those quick changes can be a really easy way of increasing your protein throughout the day. Plant-based proteins like legumes, so your chickpeas, your beans, your lentils, and then there's soy-based protein as well, so like your tofu or soy milk or tempeh, and also nuts and seeds are a source of protein. The other main macronutrient that I like to look at is carbohydrate. So carbohydrate is our first source of energy. It's a really good source of B vitamins and fiber and minerals. And carbohydrates are really important for regulating your blood glucose levels. So your carbohydrates come from things like your breads, your cereals, pasta rice, oats, quinoa, and also from starchy vegetables such as kumara, potato, corn, yam, to name a few. The other really important macronutrient in our food is fat. And fat can be a really dense source of energy, so it can be a really good thing when you're going through treatment. Fat also helps transport some of our fat-soluble vitamins, and fats are often split up into our unsaturated and our saturated fats. Now, our unsaturated fats are the ones that we try and focus on because they are better for our heart health. So they're your olive oils and your plant-based fats. But it is absolutely okay to be including saturated fats as you go through treatment, because sometimes that is a main source of your calorie intake. And that would be things like high-fat dairy products, coconut milk. So during treatment, absolutely fine to be including these types of fats in your diet. Another good example is I often recommend is cream on your cereal. So normally, we wouldn't be recommending cream, but during treatment, if you're trying to maintain weight and you're struggling, then that's an absolute fine thing to be doing. The other thing is hydration. Hydration is really, really important. So the best way to tell is if you're passing pale urine. Generally, they say 6 to 8 cups of water, but or fluid. However, everyone's slightly different because it could depend on your body mass. Really important just to sip fluids often throughout the day. So carrying a drink bottle, particularly if you're out and about at appointments, making sure you've got a bottle with you so you can sip on it frequently. And fluids don't have to just include water. It can include soup, smoothies, milk-based drinks, juices, herbal teas. Someone asked in one of the questions around an alternative to hot drinks. So things like cold herbal teas can be an option. If you don't like the taste of water, if water's taken on a funny taste from chemotherapy, then putting a few water drops in your water. You can get the little things of water drops at the supermarket. Or flavouring water with mint or other herbs and or fruit as well can be a nice way to change that flavour of water. It's really important. Hydration is really, really important, particularly if you're going through chemo, because your kidneys need to be well flushed out. So how can we meet our needs during treatment. So often looking at having small and frequent meals and snacks throughout the day. Often if you've got a low appetite, you get full quickly, really making sure that every few hours you're having something to eat or drink that has got nutrients in it as well. And I'll talk about that later. Always at all of your meals and snacks include something that has got some sort of food that's got a protein in it. So whether that's cheese on crackers or some yogurt, some eggs on toast, tin tuna as a snack, that sort of thing. So that way you're maximizing those snacks with protein as well. If you're losing weight, a really good thing I get my patients to do is look at your plate and ask yourself, can I add more calories to it? So can I drizzle some oil over my vegetables? Can I melt some butter through my potato? Can I add some sauces to add calories to my meat? Or can I put I don't know, cream into a smoothie or something like that, just to boost up that calorie. So every mouthful that you have really counts towards calories and protein. If you're able to, physical activity is really important throughout treatment. It helps to maintain your muscle mass, and also it's good for your mental health, and also it can help stimulate your appetite as well. Really important. A lot of people aren't very good at accepting help, but people are wanting to help. So if you can, do accept help where it's offered. Having lots of high protein snacks on hand, particularly going through treatment. I find, some days people come in, if they're coming in for radiotherapy, they might be coming in for the appointment, they might be for their actual treatment, they might be coming in to meet a dietitian or a nurse or their doctor. So there can be a lot of time spent, and there's not always good high protein snacks on hand that are available that you can tolerate. So having a little bag with things like some cheese and crackers, and keep a little ice pack in it, maybe if you can, with some hummus, some energy, not energy drinks, pardon me, some milk-based drinks, whether they're like calciums or calci strongs, those sorts of things. So you're getting some good protein throughout the day, and you're not getting home from a day at appointments and realize it's sort of 3 o'clock and you've hardly eaten. And another good way is by drinking your calories and protein, and that way you're also getting hydration in. So things again like your smoothies, nutritional supplements. If you've seen a dietitian, you may be on those, or any other milk-based. There's lots of flavored milks. Yes, they've got a bit of sugar in them, but they've got good calories and they've got good protein, and they're usually well tolerated. So that's sort of some of the few points that I try and work with patients when I see them. Now, someone was asking, one of the questions was around food safety and what foods to avoid when your immune system is compromised, particularly after stem cell replacement. So I just wanted to include this. And this actually isn't just for people who have had a stem cell replacement, because often people who have had chemo, or if you've lost weight, your immunity is poor, can be quite compromised and lowered during cancer treatment. So being really mindful of how you're cooking and preparing food. So thaw your food in the fridge or the microwave. Don't just leave it on the bench like a lot of people do and then get home from work and then cook it. Making sure that you're washing all your utensils and cooking areas, and keeping raw food and cooked food separately. If you've got any leftovers, pop it in the fridge straight away, and then if you're reheating it, heat it till it's piping hot and eat it within 24 hours since it's been cooked originally. There are some high-risk foods to avoid if you are immune compromised, and that's things like raw eggs, unpasteurized dairy products. Most of our dairy products in New Zealand are pasteurized, but there are raw dairy products that are available, so just be really mindful. Soft or semi-soft cheeses, and particularly cheeses that are surface ripened, like your camembert and brie. And then anything from the deli, all your deli meats, like your hams and salamis that have been sitting in the deli, and that goes for your salads and pre-made sandwiches as well. And obviously avoiding any raw smoked seafood as well. So I hope that answers the question that came through earlier. Now, I just thought I would just touch on survivorship and what nutrition plays in that role. Survivorship isn't just about our nutrition, it is about our emotional and physical well-being. And it's something that people often look at once their treatment, the side effects from treatment have settled down, and people often look at what they should be eating. Now, I can't remember if I just said it before, but really breaking down eating into two parts. So we do eating for treatment and then eating for survivorship or long-term health. So when you're going through treatment, including some of those foods that we may not normally include. But then once the side effects from your treatment have settled down, that's when you can reassess and look at healthy eating. And again, nutrition for survivorship is around the healthy food guidelines that all New Zealanders should follow. And that includes lots of fruit and vegetables, eat the rainbow. So choose lots of different fruit and vegetables that are different colors. So your orange, your red, your greens, white, purple. So eat a whole range of different colored, because that means that you'll be getting lots of different vitamins and antioxidants from the different fruit and vegetables, including whole grains. So when you're having your breads and cereals and pastas, where you can choose whole grain cereals. So maybe brown rice or wild rice or whole grain pastas. Try and add some plant-based protein to your diet as well. So that if you don't already, you can use the canned lentils or legumes, things like your chickpeas or your cannellini beans. Choose the ones that are in spring water if you can, and then add them to things like chicken casseroles or lentils to mince-based dishes, just so that you're getting some plant-based proteins into your diet. Animal products are absolutely, animal protein is absolutely fine, and we do need to include it, but choosing lean animal proteins and limiting red meat. It doesn't mean excluding red meat. The guidelines are around just limiting it, and it's about just under 500 grams of cooked red meat a week is the recommendation. So it's still a reasonable amount. Choose healthy fats, so those unsaturated fats like the olive oils, avocado oils, rice bran oil, as opposed to your butter and your unsaturated fats. And limit processed meats. There's a strong link between things like salami, bacon, ham, and some cancers. So the recommendation is to be limiting those. And also limit ultra-processed foods is another thing that's been researched quite a lot. And an ultra-processed food is a food that's got 5 or more ingredients that you probably wouldn't find in your home kitchen. So if you look at the ingredient list and there's a whole list of unidentifiable ingredients, then it's usually an ultra-processed food. And that's things like chippies, fizzy drinks, some, biscuits, things that usually have got quite a long shelf life are usually quite ultra processed. So I just wanted to cover a few common myths that come my way. And the first one is, does sugar feed cancer? It's a really common one, but it's not that simple. So there is no direct link to sugar and cancer, but there is an indirect link. So hopefully I can explain it without confusing everyone. It's really important to understand what sugar is. So I can have someone come in and they'll say, they've cut out all sugar from their diet, and then I'll do a diet history and they'll say, well, I'm having porridge for breakfast with some fruit and some milk. And I'm like, well, porridge and milk have got natural sugars in them, so you're not cutting out all sugar, and I don't want you to cut out all sugar. What I think they're trying to tell me is that they've cut out refined added sugars. So the thing is, we have got refined sugars in their simple form. So that would be your sugar that you will find in fizzy drinks, lollies, that sort of thing. And then you've got natural occurring sugars, which are in things like your dairy products, your carbohydrates, your starchy vegetables. Now, ultimately, in those natural sugars, they will break down to simple form of sugar in your body, and your body will use them in their simple form. Now, the myth of sugar feeding cancer has come about because cancer cells replicate quickly, they grow very quickly, and they need a good source of energy, and glucose is a source of energy that they will use. However, it's not only glucose that cancer cells use, they will use amino acids if they have to. The thing is, our body, all our cells will use glucose, and we aren't able to say cancer cells don't use glucose, only good cells use glucose. Unfortunately, our body is not that sophisticated. It is sophisticated, but not that sophisticated. So, in essence, sugar won't cause cancer, it won't feed cancer. But what the indirect link between sugar and cancer is that high refined sugar is very energy dense. So if we're eating lots of, fizzy drinks, lollies, cakes, biscuits that have got a lot of refined sugar in it, that can lead to weight gain, and that can lead to obesity. And obesity is directly linked to some cancers. So that's the indirect link that sugar can play in cancer. So hopefully I've been able to explain that in a version that is understandable. So when you are out with friends and you want to have a slice of cake with a hot chocolate, then by all means, absolutely do that, because no doubt you're also including a whole range of fruit and vegetables in the other part of your diet. And we don't expect you to be, following the perfect diet 100% of the time. You need to be kind to yourself and have those treats now and then. It is not going to make cancer worse, and it's not going to cause cancer. The other myth around there, or thought around at the moment, is fasting a good idea? Starving my body of nutrition before I go for treatment. There is not enough scientific evidence to support this theory. And in fact, it can be quite harmful because you are starving your body. You will lose muscle mass because you aren't providing your body with enough protein. You will lose weight, which can affect your immunity, and ultimately it can affect your treatment, and you may not be able to tolerate your treatment, and your treatment may be shortened as well. So fasting is not a good idea, and we do not recommend it. The other common myth is, do I need to take vitamin supplements? And if this has got two answers to it. Ideally, if you're eating well, a well-balanced diet, then there is no need to be taking vitamin supplements. However, there are instances where people aren't able to eat a well-balanced diet, lots of fruit and vegetables, whole grains, because of side effects from treatment. So that would be when I would recommend that you consult with a dietitian, because they can give you specialized individual information around vitamins. And unfortunately, a lot of the vitamins that we can buy are really high dose, and they often come in like there's lots of different vitamins all in one pill, and it may be that you actually don't need all of those. You just need a simple vitamin, type of vitamin. And unfortunately, because they are so high dose, they can actually interfere with your treatment, particularly with chemotherapy and radiotherapy as well, and they can be toxic. So before you take any vitamins, I would really recommend that you speak with your treatment team or a dietitian about that. All right, so just some take-home messages. I think we've zoomed through that pretty quickly. Take-home messages, really important to be kind to yourself and divide eating and nutrition into a number of sections. So eating for treatment, to get through your treatment, and whether that means you're having some pre-prepared meals, you're having some cream on your porridge, you're having extra oil, you're having things that you wouldn't normally have normally, that is okay if that is what you need to maintain weight throughout your treatment. And once those side effects have settled, then that's when you review your eating pattern and you start to work towards eating for long-term health. And that's when you start to reintroduce those whole grains, those fruits and vegetables back into your diet. Really, really important to focus on protein. I can't stress how important protein is throughout treatment and also recovery and also long-term as well to maintain your muscle mass. As I said, be kind to yourself. It's near on impossible to eat perfectly throughout treatment and after treatment as well. It's important to have, if having, that slice of chocolate cake with friends, it's about quality of life as well. So enjoy those times. Oh, I think there's a spelling mistake. Be wary of myths that are out there as well. There's so much information out on the internet around different myths and people trying to sell you things. But be really, really mindful and talk to your treatment team if you want to go down a certain eating avenue. Just make sure that you've spoken to someone, because sometimes people can end up cutting out big food groups, which actually can put you at risk of things, like if you're cutting out dairy, then there's no calcium, which can then have an effect on your bone health. So be really mindful and speak with your team, your treatment team. And if you are losing weight and are unable to maintain your weight, please speak with your medical team for a referral to a dietitian.
No, I think that brings us to a close. Belinda, on behalf of Cancer Support, Look Good, Feel Better, and everybody in the room and around the country, just want to say a big thank you to you for what you've brought today. Lovely presentation, and thanks for answering all those questions and being so informative for us. So thank you very much. It's wonderful.
You're most welcome. Most welcome.
And everyone around the room, so our next Q&A session is on practical ways to manage brain fog. So that might be a workshop that you'd like to join as well. And that's on Sunday, the 28th of June at 4 p.m. So we do hope we see you again on screen, and we'll be having more sessions coming afterwards as well. So thank you very much, everybody. Have a lovely rest of your night and wrap up warm and stay warm out there. Take care, everybody. Thank you.
Thank you.
Thank you, Belinda.